Hello, myself Jamil Hassan Khan going to give a PowerPoint presentation on lumpy skin disease. Contents: Introduction, etiology, epidemiology, mode of transmission, clinical finding, diagnosis, treatment, prevention, and control. Introduction: Lumpy skin disease is an infectious, eruptive, occasionally fatal disease of cattle and buffalo, characterized by nodules on skin and different parts of the body. This disease also causes abortion in pregnant animal. This disease also occurs in calf, heifer. Etiology: Lumpy skin disease is caused by family Poxviridae, which is also called Nithling virus of genus Capripox virus, and name of the species is lumpy skin disease virus. Epidemiology: This disease previously occurs in only in the African and sub-Saharan country. The country like Konya and different South African countries, the Konyan buffalo is the reservoir host of the lumpy skin disease. This disease also found in different parts of the world like Middle East, Russia, Turkmenistan, Kazakhstan, and this disease also occurs in India. Recently, the outbreak of lumpy skin disease occurs in Assam. The government of Assam published their guideline for prevention of this disease. Predisposing factor means the factor which helps to get these diseases. Communal grazing: if an animal is affected with this virus, and if we let that animal to go for communal grazing, then it can affect the healthy animal also. Biting fly: for unhygienic condition and and other condition, there are so many flies in our environment which can also transmit this disease. Introduction of new animal to the flock: without knowing the history, without knowing the previous history of the animal, if we introduce a new animal to the flock without quarantine, then this disease can also occur. Also, the agroclimatic condition, temperature, proximity to water, and rainfall also helps to get this disease. Mode of transmission: this disease transmit through factors. The factor like mosquito, namely Culex, Quinquefacilitas, Anopheles stephensi, biting fly, midges, ticks also helps in the transmission of this disease. Clinical finding: high rise of temperature, then numerous cutaneous lesions. These lesions rise up to the temperature, rise up to the 5 centimeter diameter. These lesions are quite bit larger than pox virus. The uh, papule to nodule. Then one of the important lesion is biscuit edema and superficial lymph adenopathy. Side by side, the milk production also decreases and mortality rate is less than 2%. Diagnosis: diagnosis is done by microscopic examination. Microscopic examination of the nodules founds that the intracytoplasmic inclusion body. Also, this disease can be confirmed by the FAT, ELISA, PCR, and also done different serological tests. Differential diagnosis can be done with sheeppox, godpox, pseudo lumpy skin disease. Treatment: there is no specific treatment, only supportive treatment. We will give antibiotic, anti-inflammatory, some supportive drugs, and antimicrobial drugs, antibiotic drugs for further infection, so that the animal does not affect. And we will give immunobooster also for supporting the animal. The incubation period of this disease is up to 14 days. Up to 14 days, these lesions will is tends to disappear, and there is formation of sequelae after once this lumpy skin disease nodules get cheese. Prevention and control: it is always said that prevention is better than control. The prevention should be done by homologous live attenuated vaccine. This vaccine comes under the brand name of Lumpy Vax, which is given once in a 6 month, like FMD vaccine. The dose rate of this vaccine is 1 ml per 1 animal. Strictly quarantine before one new animal is introduced to a flock. And then isolation: if a one animal is infected, then strictly isolation should be followed and restrict the movement. Thank you. Reference is Mark Veterinary Manual, then Veterinary Preventive Medicine, then that pictures taken from the Hindu.com and the Dhaka Tribune.